The next question is that you mentioned in your book it is not necessary to take vitamin supplements. Then do you take any supplements every day? Or under what circumstance will you suggest to take these supplements?
So the reason that I'm not particularly excited about vitamin supplements is because we have huge studies saying that they essentially don't do very much. So the biggest studies are what are called systematic reviews, and that isn't just a single trial. That's where scientists go out into the literature and they find as many papers as they can and they pull together as many as they can find. They throw out the bad ones, they keep the good ones, and they do clever statistics basically to find out the overall effect. And these big systematic reviews looking at vitamin supplements, they basically find that they either have no effect on your lifespan, or some of them, I think vitamin E is one of these, actually even seem to slightly increase your chance of death. Now, we don't fully understand what's going on here, but I think unless you've got a specific vitamin deficiency, then it's better just steering clear of these vitamin supplements because we don't really know what goes on inside the biology. The one exception to that, I do actually take vitamin D. I have to say I'm not very consistent about it. It's not as I take it every day. And weirdly, I take it, but I don't think it's going to work. Now, the reason that I do that, even though I'm not sure it's going to work, is because I think the risk of side effects is essentially nothing. There's no chance it's going to cause any serious problems, especially if you don't take. A lot of people megadose vitamin D, and I think that's just not necessary. I think you just got to try and make sure you get a fairly normal amount. But if you're taking a normal amount, the risk of side effects is very, very low. There are some studies that says it has a small effect on lifespan, but given that we don't really know, that there's some small chance it might improve immunity in old age. Nonetheless, the chance of benefit, I think, is very small, but the risk is very low, and also vitamin D is very cheap. So I wouldn't take an expensive supplement, and I certainly wouldn't take one that I thought might do me harm, but vitamin D doesn't fall into either of those categories. So when I remember, I try and take my vitamin D.
Um, I think that we always need to follow what the doctor says and the test result says, whether you really, have deficiency in vitamin, and then you need to eat some of them.